What is osteoarthritis and what causes osteoarthritis? And can you prevent osteoarthritis? Number one, what is osteoarthritis? Osteoarthritis, if you break the word down, it explains it a little better. Osteo means bone, arth means joint, and itis means inflammation. So here's one bone, here's another bone. Together they form a joint. Around this joint is a bunch of fluid. Around the edges of the bone is what's called cartilage. When the synovial fluid, or the fluid around the bones, decrease and or the cartilage breaks down, the bone starts to approximate, come together, and they start to break down. As a result, this causes inflammation, this causes extra bone formation, and ultimately pain. That's osteoarthritis. But what most people do not agree on is what causes osteoarthritis, and can you prevent it, or can you help repair that situation? So, cause. If you look up the cause of osteoarthritis, most literature will tell you that the cause is simply a lack of drugs in the system. That the cause is there was a sports injury when you were younger. That the cause is that you're too old, or that you're fat. Some of that is true, some of it is not true. Let's break it down. Number one, you're too fat. Is this a factor in osteoarthritis? The answer is yes. If you put more weight on the joint than what that joint was designed to carry, it stands to reason you'll break down that joint. However, to debunk that, there are people who've been fat for a number of years but do not have osteoarthritic joints, even on the weight-bearing joints, such as the knees. So how do you explain a person that's 100 pounds overweight for 20 years and their knees look perfect? So, although it may be a factor, it is not a cause in and of itself. Another reason, age. Age is a factor, yes, but it is certainly not a cause. Otherwise, everybody who's old would walk around with osteoarthritic joints. And we know that's simply not the point. That's not the case. In fact, there are people who actually jog when they're 80, 90 years old. There's people who run half marathons and even marathons at those late advanced ages. So age is not the cause of osteoarthritis. How about the other reasons? A past trauma. That I would agree with. If you knock the joints out of line because of an injury that took place 10, 20, 30, or even 40 years ago, it makes sense that that joint's not moving correctly, therefore it will break down. The last factor, a lack of medications. Nobody comes right out and says this, but if you look at osteoarthritis online, what you'll find is, well, take an anti-inflammatory, take a pain medication, take a chemotherapy drug, take a steroid injection. It's always oriented around how we can cover up the symptoms. It's not a lack of drug in your system that causes osteoarthritis. It's not a lack of anti-inflammatory or pain med or steroids or chemo drugs. That's not the cause of osteoarthritis. These drugs simply cover up the symptom of the problem. They don't address the cause. What is the cause of osteoarthritis? The cause is two factors, primarily two factors. Number one, the alignment of the body, the alignment of the joints. Number two, nutrition. The alignment. If your body is not lined up correctly, and your neck is out of line, and your shoulders out of line, and your pelvis is out of line, well then it makes sense that your disc would become degenerative, that you would experience spurring on the vertebrae, that you would experience hip degeneration, knee osteoarthritis and degeneration, plantar fasciitis, heel spurs, bunions, etc. These things happen to the human body because the human body is out of line. How do you explain a person that could run for 20, 30, 40 years and never have any issues with joints? Another person runs for 5 weeks or even a year and bam, they need shots in the knee and taking anti-inflammatories. I can't run anymore. I need a knee replacement. How do you explain that? You explain that because of an alignment issue. It's just like tires on a car. If my tires are riding down the road straight, I'm fine. But if one goes in, a toe in, or a camber off, what's going to happen? That tire is going to wear out. It makes sense, doesn't it? Yet we treat our cars better than we do our bodies, don't we? The other issue is nutrition. Nutrition's a factor because a lot of the food that we eat is inflammatory. And if we're eating inflammatory foods, that causes inflammation throughout the body. This explains why there's osteoarthritis in joints that are non-weight bearing, because of the foods that we're eating. What do I mean by that? Our Western diet is full of processed foods, be it wheats, flours, grains, oats, you name it. Sugar, carbs, sweets, the stuff we drink. We're always drinking non-water stuff. We're taking in dyes, colors, preservatives. All these things create inflammation in the body. And this is for another talk. But it's our diet that's primarily doing it. If we eat a diet that does not contain a lot of inflammatory type foods, and we make sure our spine is in line, whether this way or this way, our spine is in line, then our chances of getting osteoarthritis reduce significantly. And if we do have osteoarthritis, we can reduce the symptoms of it because we're not furthering the problem. Will your disc still be worn out? Yes, but just like a car tire, if I tow in that car and now the wheel's going down the road like this, I could change that tire, boom, and put the car back down, ride down the road. I'm just going to wear that tire out again. That analogy is kind of like a surgery. But if I take that worn out tire and I straighten it, I can get a lot more life out of it because now it's going down the road straight and it will wear correctly now. And I'll minimally stop the progression of the disease process. Does that make sense? Now, I certainly wouldn't want to be practicing medicine without a license. But if I were to practice medicine, what I would tell you if you had osteoarthritis is, I would tell you, take an anti-inflammatory medication, take a pain medication, let's give you a shot of steroids, and if it's bad enough, let's put you on a chemo drug that essentially stops your immune system from functioning right.